I'm KeithO Hudson. I was diagnosed with type 2 diabetes about 25 years ago. If you're a diabetic and you've struggled with weight gain, high blood pressure, and neuropathy in your feet like I have, then you might be able to relate to my situation. One of the things I've struggled with over the years is how to keep my heels from drying out and cracking. I've tried many different creams and lotions, pumice stones, and on and on. I even know friends who sand their heels. Ouch! I struggled with dry, cracked heels for a long time until I read a suggestion from a medical doctor who was a type 1 diabetic. His recommendation was to get mink oil, that's M-I-N-K oil, and rub it on your heels each morning. I'd never even heard of mink oil. To this day, I'm not even sure if it comes from minks or not, but I do know that when I looked on Amazon and found some mink oil and ordered it, then started rubbing it on my heels each morning, it made a huge difference for me. It took a while, but I've been doing it for several years now, and I have no more problem with cracked heels. It only takes a minute or so each morning. In fact, I made a little video to show you how I use it. It's not the most professional video. Applying the mink oil is easy when you have two hands, but I was holding my phone with one hand, so be patient with me. I'm going to show you my morning routine for caring for my heels. I have a package of mink oil. This is, you can read it there, Bing's golden mink oil. You can use any mink oil, but I like this because it comes in a package that I can take the lid off. I then rub this onto my heel. And then put my sock on. That's it. Again, here's the mink oil. By doing this, I never have cracks in my heels. They never dry out. I just takes a few seconds every morning, maybe a minute, and it has eliminated my previously chronic problems with dry heels. I hope this helps. Here's a picture of the mink oil I use in case you want to get some for yourself. I got that tip from Dr. Bernstein's Diabetes Solution, 4th edition. In fact, he has a whole section on foot care that impressed me so much I made a copy of it that I could print out and give to my doctor to give to her other patients who are diabetic. I will include a link in the description of this video so you can download this PDF and read it for yourself. Here, let me share it with you so you can at least see it on the screen. There it is. I'll read through a little bit of it. Because ulcers of the diabetic foot are avoidable, even when blood sugar is not well controlled, you should ask your physician to examine your feet at every routine office visit. Foot problems that aren't prevented or treated properly can lead to serious complications, even amputation. And on and on. And then this part I find very interesting. Virtually all diabetics who have experienced ongoing higher than normal blood sugars for more than 5 years suffer some loss of sensitivity in their feet to pain, pressure, and temperature. This is because prolonged blood sugar elevation can injure and eventually destroy all sensory nerves in the feet. Furthermore, the nerves that control the shape of the foot are likewise injured. You can get claw, toe, or hammer toes, high arch, etc. Perspiration, nerves that stimulate perspiration are also affected. This results in the classic dry, often cracked skin we see on diabetic feet. Dry skin is both more easily damaged and slower to heal than is normal, moist skin, and cracks permit entry of infectious bacteria. And then he gives a warning that you can burn yourself in the shower because you have impaired circulation that prevents warming of cold feet. So you can get frostbite more easily. You can be burned at relatively low temperatures. Blood circulation to the normal foot can readily increase 100-fold if necessary in order to conduct the heat of warm objects away from the skin. Impaired circulation may make this impossible, and the resultant burn may not even cause pain. I won't read through the rest of that. I will scroll through it slowly so you can see it. One thing he suggests is never going barefoot, either inside or outside. I actually wear water shoes every time I go out into the pool rather than walking barefoot. Do not soak your feet in water for more than 3 to 4 minutes, even if so instructed by a physician, because that can make your skin break down. Don't put adhesive tape on, etc., etc. Don't attempt to file down, remove, or shave calluses or corns. Don't trim your toenails if you can't see them clearly. I'm going to put a link in the description of this video where you can go get a copy of this PDF that I created by taking pictures of sections of that appendix in his book. I hope this has been helpful for you. I've been very fortunate in being able to learn how to take good care of my feet and having doctors who worked with me and that allowed me to educate them as I got educated, and having a very supportive spouse. I wish you well with your journey to improve your diabetes. Thanks for listening.